Have you ever wondered, why does oral sex sometimes feel awkward, uncomfortable, or even disappointing? You are not alone. Many people struggle with questions like, am I doing this right? Am I causing discomfort? Could I be putting us at risk? Today, I want to help you answer those questions because when oral intimacy doesn't go well, it can lead to frustration, insecurity, or even physical discomfort. But when done with care, it can be deeply connecting and pleasurable. In this video, I'll walk you through 5 practical, medically informed tips to help you feel confident and skilled while staying safe and comfortable. Stick with me until the end. Tip number 5 is often the one people forget, but it truly makes a difference. Let's begin. Tip number 1, talk before you act. It might sound obvious, but often the biggest barrier to a satisfying experience is lack of communication. Ask your partner what they like, what they don't like, what's too sensitive, what areas they want more or less of. Use phrases like, "Does this feel good? Tell me to stop or change if you need me to." Also, get explicit consent, meaning both parties agree, feel comfortable, and can stop at any time. This builds trust, relaxes nerves, and ensures you're both mentally there, which is just as important as physical technique. Tip number 2, get the area ready safely. This means basic hygiene, a gentle wash of the genital area with mild soap, no strong perfumes. But here's a surprising note. Avoid brushing your teeth or flossing just before oral sex. Why? Because those actions can cause very tiny cuts or bleeding in gums, which increase the risk of transmitting infections. Instead, rinse gently with water prior to. Afterward, you can brush if needed. Also, make sure your mouth is healthy. No sores, ulcers, cold sores, or open wounds. If there's any sign of infection or irritation, skip it until healed. Tip number 3, protect while you pleasure. Even though the risk of STI transmission via oral sex is generally lower than vaginal or anal, it's not zero. You can still pass or get infections like herpes, gonorrhea, chlamydia, HPV, and more. To reduce risk, use a barrier method. For oral on vulva or anus, use a dental dam or a cut-open condom as a sheet. Change the barrier anytime you switch between areas, mouth to genitals to anus, to avoid cross-contamination. Also, try to avoid letting semen or vaginal fluid linger in the mouth. You can spit it out or use the barrier to catch it. Tip number 4, be gentle, responsive, and varied. Here are tips you can incorporate. 1. Soft lips over teeth. Use your lips like a cushion so teeth don't scrape sensitive areas. 2. Hands plus mouth synergy. Use one hand, or two, along with your tongue, especially on the shaft or labia, to add pressure or texture. 3. Focus where it matters. Many people are highly sensitive at the head, the glands, of the penis, or the clitoral hood or clitoris, but every body is different. Ask and adjust. 4. Change pace and pressure. Start slow, warm up, and then vary speed or pressure. If your partner is approaching climax, sometimes keeping a consistent motion is better than suddenly changing. 5. Use a swipe, flick, or circular motion, not just up and down. Gentle swirling, lateral motion, or teasing movements can be more pleasurable. 6. Pause and resume. Sometimes a short rest, a kiss, a gentle touch elsewhere, then return heightens sensitivity. The key is stay present, read your partner's breathing, moans, body language. If they tense, slow. If they relax, continue. Tip number 5, the one many skip: aftercare and debrief. Right after intimacy, we often just move on, but pause, share a cuddle, a kiss, talk. Ask gently, what felt great?
what would you prefer I change next time? This helps both partners feel valued, heard, and connected. Also, do a gentle rinse of the mouth with water afterward. Wait 15 to 30 minutes before brushing teeth if possible to allow any microscopic abrasions to heal. If either partner notices soreness, odd lesions, or symptoms like unusual discharge or pain later, see a clinician and get STI testing. Many infections show no symptoms but are treatable. Over time, keep refining, experimenting, listening. All right, as promised, here's a bonus tip many don't know. Understand hormonal and arousal changes as we age. For older adults, changes in hormone levels like lower estrogen in women or lower testosterone in men can influence sensitivity, lubrication, or response. So take extra time with foreplay. Use high-quality water-based lube compatible with latex if using barriers. And don't rush. What felt great at 30 may not feel the same at 60, and that's okay. Adjusting pressure, technique, and softness can really improve the experience. This bonus awareness often makes the difference between an average session and a deeply satisfying one.